Hey guys, welcome back to Defeating Hair Loss. I'm Steve, and I again have Bobby D.
Yes, sir.
Back with me. Man, hair, body, he's back. How you doing?
I'm good, Steve.
Cool. Well, Bobby tonight was given a homework assignment. Sounds wonderful, right?
Exactly.
How long have we been doing these? How long have you been sitting next to me here, helping me, supporting me, being my friend, Bobby? How long has it been?
Probably about 6 months now.
6
We
months.
started the channel, I think, something like that.
6 months. 6 months.
Time
Yeah.
flies when you're having fun, Steve.
Hey, isn't it cool?
Yeah.
And the comments and the questions.
Exactly.
And we're just out here trying to help you guys with hair loss. So it's funny because I actually did give Bobby a homework assignment. And I said, listen, here's what I want you to do. You're just a regular guy. Now you got a little bit of a jump start, head start, because you went through 2 hair transplant procedures. So you're not exactly a newbie out there. And what we wanted to do, or what I wanted to do, was really just get Bobby's feedback on this channel. So I said, come up with the top 10 things. Don't try to overthink it. Just come up with the top 10 things that you feel you've learned, which maybe you knew but you didn't know before, but now you realize how important it is, looking at those questions, those comments, and seeing what you guys are talking about out there. So you got 10, right?
Yeah.
Let's fire away. So hair transplant top 10, I'll call it the midterm final exam.
10. All right.
Okay? All right, let's do it.
All
So
right.
What's number 10?
All right, Steve. So, obviously learn from the best. So number 10 would be, choose a hair transplant specialist that is board certified.
Excellent start. Excellent start. So yes. So, we need to have some sort of a starting point. We need to have kind of like, to keep it kind of fair, we need to help you guys, you girls, figure out like where to start. Board certification doesn't mean that a doctor out there somewhere in the world who's not board certified is not good at hair transplants, but we got to have a starting point. Now, doctors that are board certified need to go through a series of certifications, which means they're very serious about this, which means they don't do this part-time, not most of the time. They are specialists, which is kind of what we found for you and what we found for me and the doctors that I work with. So that is a really good find. Number 10, find a hair transplant specialist that's board certified. How about number 9?
Number 9, Steve, would be using finasteride and minoxidil as preparation for your hair transplant.
Preparation, right?
Yeah.
Preparation. So Bobby, it gets drilled into him. Now, don't forget, we got Bobby Dunlap's channel.
Yes, sir.
He's killing it on YouTube, and I'm doing my best to follow in his footsteps in that regard. And he's got a lot of hair stuff on there as well. And what do we talk about most of the time?
Always finasteride.
And what do we talk about here most of the time?
Finasteride and minoxidil.
And why do we talk about that all the time?
Get your hair fixed, basically.
So what we want to do is give you good content, good information, solid, objective information to understand that the end of the world is not when you take finasteride. It's not going to hurt you. You're not going to get side effects. But guess what it's going to do?
Make your hair stronger.
Make your hair stronger. It's going to prepare you for a hair transplant if that's what you want. And if you want to stop your hair from falling out, and I think we all want that,
exactly.
It is about 98% effective. So that is a great one. That is excellent. Number 9. How about number 8?
You must have pretty realistic expectations when you go in there.
Expectations. So we talk about it time to time after time on these videos. We talk about the expectations, and it's very interesting that you say that, and that's a great one, because like if you look at me and Bobby, if you were here in this room, he has very strong donor hair, and that's like 80% of this whole thing. I don't have strong donor hair. I've been fighting and battling and trying to fix this my whole life, and over the course of a couple years and 2 procedures, he's a rock star. Now, he's also had a great surgeon from the get-go. I didn't have bad surgeons. I just didn't have on this caliber. And I, didn't have the use of finasteride, which Bobby started right away. And you know the rest of the story. So the success that you see is based on, what he thought he was going to get. And, we can tell the story again. I begged you not to do the second procedure.
Here we are.
Because I thought that the first procedure was completely a home run. And, you bypassed that, which I applaud you for. Now you look even better. So, but your expectations, right? Everything is in line. So continue to watch us, and we'll help you with your expectations based on your donor hair, your age. Are you using the medicine? Are you not? Which procedure do you choose? Is this even a good idea to do? That's an excellent one. So how about number 7?
Yeah, this is one of your pet peeves, Steve, is always plan on 2 procedures.
Always plan on 2 procedures. So we're going to probably talk more about this. I don't know the rest of your list, but my middle name is worst case scenario. If something bad is going to happen somewhere that I'm involved, it's going to happen to me. That's how I've lived my life. And we've talked about it before. I live my life in fear. And for years and years and years and years, kind of sort of now, but not that much anymore, I feared going bald. Of course, after already going bald, getting hair transplant, wearing wigs, all that kind of stuff. So when I talk to patients, when I communicate with you, I want to make sure you understand that it probably is going to take 2 procedures. Now I can start to narrow down, the different subsets, right? All women, doesn't matter what age, what race, they're all going to need 2 procedures. It's a credit to women. It's a compliment. They're very much more articulate than most men. They don't just want some hair in their hairline. They want it all the way it used to be. And you've got young guys, good-looking guys that want their hair the way it was as well. And they throw in the dark hair and the light skin, which we talk about over and over and over. So let's just say this. Let's just say all of you out there have been watching these videos, plan on 2 procedures. Number 6, Bobby.
Yeah, Steve, there'd be to visit clinics that offer both FUT and FUE procedures before deciding on the correct doctor.
Excellent. You're scoring 100 so far.
I try. I learn from the best.
So what we want to do is we want to take away the prejudicial or discriminatory kind of bias in these 2 different procedures. We constantly do FUE versus FUT, FUT versus FUE. We talk about it all the time on this channel, and there's so many other guys out there talking about it as well. And what we don't want to do is go visit a clinic that only does FUT, because guess what? You're probably a candidate for FUT. And if you go to a clinic, and there's a lot more of those now, that have bought a machine and they're only doing FUE, well, they were trained by that machine company to tell you, forget about FUT, it's old technology, this is the only choice for you. Those are just not true. So when you go to a clinic that does both procedures, and I call them, again, going back to the board certifications, the specialists, doctors that are really good at doing hair transplants, they can do either procedure. So even if it's just for the consultation, make sure that you get their opinions. You don't have to do your surgery with that doctor. If the doctor that does both procedures says FUE is a better choice for you, you can skip over that doctor in case he's not in your area or whatnot and go find a fantastic FUE doctor. But now at least you know that that's the one for you. Does that make sense?
Yeah.
Okay, what's number 5?
I'll say, scarring. Since you have an FUT procedure, always expect the worst case scenario with that.
So the scarring is something that's a new pet peeve of mine, and I'm trying not to show my age and trying not to make this a generational thing. There's a few videos we've done. Ironically, I'm doing another one while we're here tonight on scarring. And just keep this in mind, okay? Results are going to vary. There are no guarantees with how you're going to scar. And make sure you understand that whether it's FUT or FUE, you are going to have scarring. It's a little bit different types of scarring. And don't drink the Kool-Aid that you can get FUE and have no scarring and wear your hair as short as you want. Because that is simply not true. It is possible, and it can be done in many different cases, and they're probably all over the internet, and that's why you're buying into that whole FUE thing. But I'm just telling you right now, be very careful. No one can guarantee you how short you'll be able to wear your hair in the back, whether it's FUE or FUT. Number 4.
Yeah, Steve, when you're researching a clinic for a hair transplant, make sure to review their photos and videos. Make sure they're not just cherry picking the best results.
So it's interesting, right? I don't name any names. I don't name any doctors. We don't name any countries. But there's just not a lot of examples of the work that doctor himself has done. There's a lot of before and afters floating around now on social media, and it's for all over the place. And you're seeing somebody at the pool in Miami, hey, I got a hair transplant, and he claims that some doctor did it over in another country or whatnot. What you need to do is really take your time, spend time with that clinic, and make sure you're able to review work that is done by that doctor, him or herself. You want to know their techniques and how they do it and how they feel about your situation. Bobby with the light skin, dark hair, me with the lighter hair, lighter skin, but at the same time, thinner hair, which in my case, I don't want to say this is an advantage, but at least it's uniformly thin. So I don't have to worry about, like the different kind of patchiness of it, if that makes sense. So everybody may have some advantages and everybody may have some disadvantages. So we definitely want to inspect the doctor's work. Bobby's appears on Dr. McGrath's YouTube channel, And I myself do comb throughs on his hair. It looks fantastic. We even did it after one procedure. So you can then take his example on that video and you can stop it in the middle of the video so you can actually see the spacing that that doctor has done with his hands in spacing out those grafts. And that's a way for you to research. Yeah. Number 3, Bobby.
Exactly. Be a compliant patient. You know, do what they tell you before the surgery and after the surgery. Just follow their steps.
You are really good.
Yeah, because I was one of those patients who was always bothering you.
You're doing good tonight. You can bother me all you want. And listen, I will never let anyone wear me down. I've got patients that text me every day. I might not be able to get back to them that very hour or that very 10 minutes, but I definitely, at the end of the day, or maybe on the treadmill or the Stairmaster is my new thing, be able to get back to them. But yes, be a compliant patient. Make sure that you set yourself up to be compliant. Don't be a cowboy. Don't run around, like thinking things and I have my procedure done here, but I got to ask this doctor this question and all this stuff, and you're all over the map and you're all confused. There's a year of follow-up, and if you have questions, if you have concerns, if you're worried about something, contact the clinic and they will settle you down and they will make you feel comfortable. And worst case scenario, it's not a bad thing, is bring you in and go over everything. And it's I've been doing this a really long time. As long as you go to these top clinics, top doctors, you really have nothing to worry about. Number 2.
That'd be watching this channel, Defeating Hair Loss, and also my channel, Bobby Dunlap, because you're on there all the time.
Bobby Dunlap's YouTube channel and this channel. It's funny. That's great. He's getting good. He's getting good. I've been wanting to do this since I won't even tell you the year. It's a long time ago, and I didn't know how to do it. And being on David DeMuzio's channel, and now that channel is called Lock Lab, and we're all a team. It has really, David's amazing. His videos are amazing. And Bobby Dunlap, his YouTube channel is amazing. And it's not like I want to be amazing. I just feel like I was born, crazy as this may sound, to go bald, get it fixed, and then help others who, I don't want you to go bald. So watch this channel. Check it out. And by the way, there's some goofy stuff on there. Not goofy, stupid, but it's kind of what's in my mind. And the one we just did, the Legends of the Fall with Brad Pitt. It's try to. It's only a couple minutes, so try to sit through it. But see my point. It's just really cool hair, and that's also what this is about. And we got some hair in the news as well.
Yeah, we do. Yeah.
All right, what's the number 1, Bobby? What's the number 1?
Let me see. It's way easier to keep what you have than get back what you lost, Steve. I would have known that before.
You are a good student.
I try.
You are a good. So yes, the number one thing that Bobby picked up, and then I talk about all the time. Think about this. It's much easier to keep what you have on your head today than to try to get it back starting tomorrow. What does that mean? Well, you getting on these preventative treatments at least buys you time until you make some sort of a decision. And there's a good chance that getting on these preventative treatments can actually give you what you want. But you're never going to know if you're scared to death of these things, or you live in fear like I have my whole life, and you just start losing your hair. So please stop your hair from falling out. The way you do that is you get on preventative treatments, and they're all over this channel and Bobby Dunlap's channel. And you do that by keeping what you have, and it's easier than getting back what you lost. And think about this, the whole motivational thing. We did a couple of those too, right? Is today, actually it's tonight, you will never have as much hair in your head for the rest of your life as you do right now. Like tomorrow, you won't have as much hair as you do tonight. And if you're not taking the preventative treatments, that's going to go on and on and on and on. So you need to put it to rest. Get on the preventative treatments. If you're afraid of the medicine, use topicals. If you're female, let me know. I'll tell you what to use. You got to get in laser. You got to get on some orals. We've got to figure this out because we want you to keep what you have today. And then if you decide to do the restoration, like this young man who looks fantastic, then you have all the opportunity in the world. So you don't have to go through what I went through, even though I think I'm looking okay.
You're looking good, Steve.
Thank you very much. Hey, this has been a really long but really cool and entertaining midterm exam. Bobby, guess what score?
100.
A+, baby. Great job. Thank you so much.
Yes, sir.
That was fantastic. Hey, I hope this helps all of you in your decisions with your hair loss. Don't forget to like and subscribe.